As the world commemorates World Hepatitis Day 2021, Rotary Clubs in Ibadan have called for increased awareness about how to prevent the disease to reduce its burden in Nigeria. The Rotary Clubs made the call at the Hepatitis Zero World Eradication Program held in Ibadan. Stakeholders who spoke to the News Agency of Nigeria at the event emphasized the need for greater attention to hepatitis such as has been given to COVID-19. Mr. Samuel Kolawole, President of Rotary Club of Ibadan Jericho Metro, said the event was to raise awareness about hepatitis and vaccinate members of the community to reduce the burden of the disease.
Today is World Hepatitis Day, and Rotary Club, as we know, Rotary International has as one of its focus disease prevention, and we thought that we could do something on this day to further that area of focus, and that is why we have decided to key into the World Hepatitis Day to conduct tests for members of the public and to also do vaccination for those that we find negative of the disease. So that is what today is all about. We intend by doing this to raise awareness about the dangers of that disease, hepatitis, and we hope that those who are here today will also carry the news to other people to let them know that this disease is prevalent and the dangers that it portends. It's a serious, it results in serious liver disease. It is said that about 500 million people all over the world carry this disease, and it kills people, die from some of the effects of this disease on the liver and other organs of the body, not less than 1.5 million per year. Rotary has been involved in the eradication of polio in Nigeria, and it's also doing the same in other parts of the world. You need the support of these organizations to be able to. The government alone cannot do it, but government should provide the enabling environment and the support that is needed by these organizations, so that when organizations want to partner with government, it's not difficult. The bureaucracy should be removed, but government should also invest more in the health of the people and make the health system such that will make access to good health care easy to do. When the primary health care centers are made functional, it prevents a lot of complications before it gets to the advanced. Not everybody who has a headache has to go to UCH.
Mrs. Helen Opola, Assistant Governor of District 9125, said the event was an annual program which started about 3 years ago with just sensitization.
But this time around, we are giving people vaccine. So for the 3 doses, the first one will commence today, then the second one after a month, then the last one will be after 6 months. Polio has gone out of existence in Nigeria, and we think the next thing we need to focus on is hepatitis B and C, because we see that these are the things that people are suffering for, the kidney, liver, and so on and so forth. So we think we should focus on the next illness that people are facing all over the world. At least we are expecting hundreds and over 100, almost 200 people.
Mrs. Samiat, Chief Nursing Officer of the University College Hospital Ibadan, said Nigeria, with an estimated population of 190 million people, had hepatitis B prevalence rate of 8.1% and hepatitis C of 1.1%.
We are trying, that is, we have the governments are doing their own. That's why we have non-governmental organizations like what the Rotary is doing now, to sensitize people, to do tests for people, and then to vaccinate people against the hepatitis virus. And at each antenatal clinic, all health centers, all hospitals, we are talking about hepatitis, including HIV and then COVID-19. So we are trying to create awareness. I think the media creating awareness, the government is doing their own part. We have the NGOs doing their own parts to sensitize people. I think we can encourage all the chiefs, the ballers, the head of communities to talk about hepatitis to their people. And we have been talking about counseling against sharing of blades, sharing of sharp objects to prevent hepatitis transmission in the community.
Beneficiaries of the program commended the Rotary Clubs for the efforts to create awareness about hepatitis B and C to reduce incidences of the disease in the country.